A retinal vein occlusion is essentially when one of the veins in the eye that's responsible for taking blood out of the eye gets plugged up for one reason or another. And this causes blood to backflow and to spill into the retina. This condition is picked up quickly and the patient is properly triaged to the right treatment, whether that's an injection or having to get laser done. We stand a good chance at getting some vision back in that eye. The symptoms would be painless, blurry vision loss in one eye. And the reason for that is because fluid or blood is building up in the center part of the retina called the macula. It's a fancy word we call macular edema, but basically that just means that fluid is building up and the retina is thicker than normal. So that'll contribute to blurry vision. It could also make things look distorted that should be in a straight line. A patient will usually identify this or know that something bad is happening because they'll have acute onset of blurry vision in one eye. And this is a condition where it's relatively urgent or emergent in the field of retina and ophthalmology. If a vein occlusion happens, it's important to get checked out. The main risk factors for this is high blood pressure. People who have a history of glaucoma, where their optic nerve might be a little thinner compared to others, can more easily have one of the veins pinched off. The treatment approach to retinal vein occlusion is sort of a stepwise approach. Some vein occlusions can be relatively mild. If there is no swelling in the center part of the retina, and there's no abnormal blood vessels growing from the retina into the center part of the eye, these patients can just be watched closely. If a patient does develop swelling in the center part of the retina and the vision becomes blurred, we typically treat this with a class of eye medications that we inject into the eye called anti-VEGF agents. It's just the name of the type of medication we use. That's responsible for essentially making those blood vessels a little bit less leaky so that swelling in the retina will go down. These injections, we typically start them 1 month apart because that's how much time you need in between administering the injections. And we continue those until the fluid that's building up in the center part of the retina is under control. Once that fluid is pretty much all the way gone, then you're able to start spreading out the time in between the injections. Now, some patients get to the point where they don't require injections any longer. Other patients require injections for an extremely long period of time, but they are able to go, bigger gaps in between appointments. So this is sort of a chronic condition that requires monitoring over a long period of time. And the more severe form of this would be when you develop abnormal blood vessels that grow into the eye. And this is if the vein occlusion has been going on for a long time. In that case, we might recommend putting laser into the retina. We actually use a laser that's mounted to a headlamp to treat those areas, and that makes those abnormal blood vessels go away. You don't get complications such as bleeding in the retina or a special type of glaucoma called neovascular glaucoma, where the pressure can go really high and cause vision loss. It's important not only to treat to improve vision, but to prevent some of those worst complications that could happen if it remains untreated.